News Radio 700 WLW.
Well, in addition to everything else you need to worry about in these final weeks of December, you need to worry about your heart. Because the stats will tell us there is a spike of about 30 to 40% in the last couple of weeks of the year, most notably the week between Christmas and New Year's, in the number of heart attacks. Family stress, an issue. Maybe not keeping up with your healthy habits is an issue, but it is an issue. And ER rooms all across the country will back this up. So what's going on here, and what can we do to avoid being a statistic, if not a patient in a hospital? Standing by is somebody that knows. We've had Dr. Fahmi Farah on many times. She is a cardiologist and passionate about this kind of prevention. She joins us again live here on 700 WLW. Dr. Farah, how are you on this glorious day?
Hey there, I'm doing wonderful. Merry Christmas.
Merry Christmas to you, too. And I hope the new year is good for you as well. You've been a good guest of this program for many years. I just want to, just off the top, why is there always a spike in this week, particularly between Christmas and New Year's? Is it all tied to stress and overindulging, or is there something else going on here?
It is more than one reason. It's a multifactorial issue. You're right. We see as much as between 20 to 40% increase in patients coming into the hospital and ERs with either heart attack or heart failure or some kind of heart condition during this period of the year. Usually it has to do with stress, definitely plays a role, but also food. Typically during this time of the year, the food tends to be pretty unhealthy. We tend to have a lot more fat, high in cholesterol, and high in sodium, which contributes majorly in some of the hospitalizations we see. So when we have higher amounts of sodium, which is salt, in our food, it can push somebody who, for example, has a pre-existing condition such as heart failure. It can push them over the edge, and they can go into acute heart failure, start having shortness of breath, swelling, and end up in the emergency department. Stress, of course, is a major contributor. During this time of the year, people tend to have, financial constraints, having to spend money on festivities, food, presents. Non-compliance is a big issue as well. People tend to travel distracted with family members, guests visiting. They tend to not take their medications as scheduled, just deviating from their routine of not exercising, not eating healthy. Alcohol consumption goes up as well. That can definitely increase the risk of all sorts of heart conditions, including heart failure, heart attack, as well as arrhythmia. And cold plays a role as well, I will say. There are areas where it gets very cold and it snows, and snow shoveling for people who are not used to that kind of activity, and suddenly they have a spike in their metabolic activity rate with snow shoveling, it can push them over the edge and they could have a heart attack. So yeah, it's multifactorial.
Yeah, snow shoveling. That's why God created kids, right? I mean, they go out and shovel the driveway. You don't have to go out and shovel the driveway. I think it's one of, but in all sincerity, you mentioned a couple of things there. For example, sodium. All right, I mean, we know about drinks. I mean, you're not supposed to overindulge in that. We know about fatty foods, but sometimes you eat what's in that food you don't know. When I think of sodium, I think of soup. Are there other foods that have a lot of sodium in it this time of the year?
Does, actually. You're right. Soup typically contains quite a bit of sodium, but practically everything we eat during this time of the year has high amounts of sodium. For example, the gravy, the potatoes, turkey, all the seasoning, ham, because ham is usually pre-processed, and anything that's pre-processed tends to have lots of sodium and preservatives in it. So it's all those ingredients that kind of come together and can push us over the edge.
Gotcha. Okay. Let's talk a little bit about warning signs. I mean, pain down the left arm. That's always a classic one. But there are other things too, because we're not really just talking about heart attacks here. We're talking about stroke. Stroke can happen as well. I mean, so if you're, kicking back, maybe you got the week off, maybe you're going to some parties, you don't feel right, but you're not sure why you don't feel right. Give us the warning signs here in this highly stressful week that we're in.
Absolutely, yes. Stroke is a major issue as well. So typically when people have a stroke, some of the warning signs would be that they will have paralysis type symptoms on one part of the body, usually weakness, either in their leg or arm on one side of the body. Sometimes they'll have difficulty speaking, they'll have slurred speech, or they'll be able to speak but not make any sense of what they're saying. They'll have drooping of one side of the face, have difficulty with balance. They can get off balance. All those are signs for stroke. And some common signs for heart attack, as you mentioned, tingling, numbing sensation on one side of the arm. But some of the classic signs would be crushing chest pain, shortness of breath, numbness of the arm and jaw. But there are some times when people won't get those classic symptoms. There are atypical symptoms where they won't have any chest pain at all. They'll have something like indigestion and nausea, vomiting, profuse sweating, things like that. Those, we need to be mindful of as well.
Gotcha. Dr. Farah, you can be reached where? How do people find you? Because my guess is, they heard you today and they're thinking, I hear her a lot on Ken's show. How do we get a hold of her? How do people find you?
Well, they can find me at bentleyheart.com. That's my website. Also on social media, on Instagram, it's Fahmi J. Farah, same handle on Twitter.
Gotcha. Always great catching up with you, Doctor. You stay well. As you said, Merry Christmas, and I'll say Happy New Year. Stay well. We need to hear your voice. Thank you.
Thank you. Happy New Year to you.